Namaskar. Let's study about the remedy Dioscorea Villosa from Dr. N.M. Choudhuri's Materia Medica. Now, this remedy, this plant is commonly called as wild yam and it belongs to the Dioscoreaceae family. It is actually a perennial creeper which looks like this and it grows wild in the southern states of North America. Now, let's also see what is the Materia Medica of this remedy, what Dr. N.M. Choudhury writes about this remedy. He says that it is a great anodyne, a painkiller. Its actions far excel those of opium and morphine, as we will see presently. So, can you imagine? He is saying that opium and morphine are also not as good painkillers as Dioscorea. It's interesting because we always think that opium and morphine are like the most and the greatest painkillers that we have. But over here, Dr. M. Chaudhary tells us that Dioscorea is even better. So let's see further, let's understand further, and we'll also know why does he call it the greatest painkiller, right? The pains of Dioscorea are actually neuralgic in character. And since they're neuralgic, that is also the reason why it is very difficult to explain why and wherefore of this pain. All that is possible for us to do is to arrive at the problematic factor, what is happening, and we'll ascertain the symptoms and we'll go for the remedy. But it's difficult to understand why it is happening, why for of this pain, right? And then further he explains us about the sphere of action of this remedy, a little bit of this about the sphere of action of this remedy, and then again he goes back to talk about the pain of the remedy. Further, he has also given us a case of this remedy, and there's a whole discussion after that as well. So let's go ahead and talk about the sphere of action of this remedy. So, Dioscorea acts upon the solar plexus and upon the spinal nerves. Now, what is solar plexus? Solar plexus is just a collection of, two bundles of nerves or ganglions. So, it is a collection of bundles of, nerves and ganglions that intertwine and pass each other at a central location in the abdomen. So this can be that location. This is that location where inside the body, the nerves, the bundles of nerves or ganglions will intertwine, pass each other at this location. It acts upon that solar plexus. That is indirectly it acts upon those nerves and also upon spinal nerves. Thereby, it causes pain over the body and in viscera. So since it affects those nerves, it's obviously going to cause some problem in the abdomen, in the viscera, in the in that local area. Now this also affects the ganglionic nervous system, particularly of the umbilical region. So basically the whole abdomen is involved. So since the nerves over here are involved, the pain will also affect the area around it, thereby producing symptoms simulating an attack of bilious colic. So the patient will come to you with great excruciating pain and you're going to think that it's a bilious attack, but it might not be if it's Dioscorea, if it's a case of Dioscorea, right? So if it might not be bilious colic, it's just some nerves getting stimulated and affecting you. Since this if these nerves give you pain, it will simulate an attack of bilious colic. Now, Dr. Phatak also says that Dr. Phatak, Dr. Boric, both also tell the same thing in different words. It acts on nerves, abdominal, sciatic, and on spinal cord. So, since nerves of abdomen, we just know about it right now, but also of the sciatic nerve. It also has an action on the sciatic nerve. So sciatica is also going to be a huge problem in Dioscorea, right? And it also acts on the spinal cord. Now, Dr. Boric also tells us that as a remedy for many kinds of pain, especially colic and severe painful affections of abdominal and pelvic viscera. So it can be abdomen or it can be pelvis. The organs over there, the viscera, can get affected, finally producing colic. So this is the sphere of action of this remedy, majorly involving abdominal nerves. Right. So that is what we have to remember as well. Moving ahead, Dr. N.M. Choudhury writes that there is a statement of Burt which is particularly illuminating and should be very convincing. So the statement that Burt has made is that the grand sphere for the use of Dioscorea is among necrosis of the bowels and stomach. Necrosis of the bowels and stomach. So this is the pathology that you see in Dioscorea, is what he's saying in different words. Okay, so grand sphere for the use of Dioscorea is among the necrosis of bowels and stomach, where where what happens is the celiac and the umbilical plexus, again the nerves involved there, are in a state of great hyperesthesia and the pain and spasm being unbearable. So he is telling you that if this kind of pathology exists, then it will stimulate your nerves over there, that is the celiac and umbilical plexus, and will send those nerves into a state of hyperesthesia, and that is why the pain and spasm that these patients will feel will be unbearable. And since the pain is unbearable, hence we are saying that Dioscorea is a great painkiller, right? Since after giving Dioscorea, this unbearable pain is coming into control, it's going off. Now, the pain has been very beautifully explained in details. The type of pain is that it is intense and cutting, twisting, agonizing kind of pain. And it radiates all over the abdomen. So it's not just, restricted to a kind of locality or kind of region in the abdomen, but it is radiating all over the abdomen. There are sudden shifting pains from original area of affection and the reappearance of the pains in distant locality, such as fingers and toes. So they shift from their original area of affection and they reappear on a distant locality. That is what is important, right? They're not just shifting or radiating all over the abdomen, but they're also shifting to distant locality, such as fingers and toes, which are not at all related, right? Not at all related as we think them to be. Now, Dr. Phatak says that pain suddenly cease in one part, then start in another part. Again, something that is similar is what he says also. Now, the sensation is that the gut feels like being twisted almost mercilessly. So, the feeling is as if the gut is being twisted. Yeah, it is being twisted most mercilessly. And since the pain is so much, Phatak says that there is nervous shuddering from pain. And what can be the ailments for such kind of pain? So there is excess in eating or errors of diet can also easily affect these patients. Ill effects of excessive tea drinking can be there. So now we know that the pain of Dioscorea is such. First of all, the character of pain is such that it is intense, cutting and twisting kind of pain, right? Twisting kind of pain. It is agonizing. It has to be agonizing since it's unbearable. It's like the intense pain, right? Intensest pain that we have, and it radiates all over the abdomen. And now we also know that it just does not radiate all over the abdomen, but it can go to distant localities also, just like fingers and toes also. Okay, the same thing is what Dr. Phatak also says. And the sensation is very important. The sensation that these people have is as if the gut is being twisted most mercilessly. And they're shuddering from this kind of pain. Now, Dr. N.M. Choudhuri also shares a beautiful case that he has, cured of Dioscorea. Let's see what that case is. So Dr. N.M. Choudhuri says, it must be fully a year ago that I was called in to see a case of abdominal colic. So he was called in to see a case of abdominal colic. And the impression that the patient created on my mind, meaning on Dr. N.M. Choudhury's mind, will, I am afraid, never be effaced till death brings oblivion. Can you imagine? So the patient must have come to him with such situation, such impression that he has created on this doctor, which himself is a master, that even this doctor remembers it so much that he says that it will never be effaced till till my death. So what kind of situation this patient has had would have come to him with, right? So he paints the picture that the patient had created in front of him, and he gives it to us also. He tells it to us also. So this patient was writhing in excruciating agony. Okay, excruciating, since until now we've understood that it's intense pain is there in Dioscorea. Okay, so he was writhing in excruciating agony, and the pains were neuralgic, as we already know. They were paroxysmal, so they're coming and they're going. He felt as if his entrails, meaning his gut, meaning his intestines, were clutched by a powerful hand and twisted mercilessly. Can you imagine that kind of sensation? That kind of sensation must be so painful. So he felt as if he literally felt as if his guts were clutched by a powerful hand and twisted mercilessly. This is the sensation. Now, the intensity would increase with every second of pain. So the intensity would go on increasing with every second till at last it seemed almost to tear asunder his strings of existence. Then, all on a sudden, the remission would come, bringing with it a few minutes of ease and quiet. So what would happen is that the intensity would increase and increase and increase and go on increasing until it reaches a point where now the patient feels that I'm just going to die. Okay, that much pain. I'm just going to die of pain is what the patient will feel, and until that point the intensity of the pain would just go on increasing and increasing and increasing until then, and all of a sudden after that the remission would come, bringing with it a few minutes of ease and quiet. So that is what is called that is why it is paroxysmal. Okay, it's coming in episodes, so it will be there with huge intensity and will go off for some seconds of minutes and then it will again come back. The pain would begin in the region of the bowels, yeah, and then radiate upward and downward until his whole body would be involved, eliciting shrill cries from him. So the patient is crying in front of you due to pain. You are the doctor. You are responsible for finding out a remedy for him. And this is the whole situation. Now you know that it's not his abdomen that is paining, but the pain is radiating so much all over the body, upward and downward, that the patient is in complete pain. So the whole body is painful now, and the patient is crying out of pain, and you are the doctor. You understand the situation here, and that is why Dr. N.M. Choudhuri says that he is never going to forget the impression that this patient has created on him. So this is very important. Then what he says is a few doses of Dioscorea, just a few doses of Dioscorea, soaked it like oil on the surface of troubled water. Such then is the power and efficacy of Dioscorea in colic. Now we understand why he says that this is the greatest anodyne, even greater than opium and morphine. It was due to this case. You see, the pain is so much, the patient is creating this whole picture as if he's just going to die. And then giving Dioscorea is helping him within a few doses actually. So that's an amazing case by Dr. N.M. Choudhuri. Now let's understand the same thing that we've been studying through Materia Medica and from Phatak, Boric, and also N.M. Choudhuri until now. Let's study that from Ken's repertory, what rubrics he has made, okay? So the abdomen, pain, wandering, shifting suddenly to distant parts. Abdomen, pain, umbilicus region of, abdomen pain, cramping, gripping, abdomen pain, cutting, paroxysmal, extending distant parts. So these are some of the rubrics that he has, made from symptoms, and these all have been taken from Ken's repertory. And also further, as we go ahead in the video, we'll see some other rubrics also, and those have also been taken from the Ken's repertory only. Let's study about some symptoms which are also related to stomach and abdomen but not related to the pain. So until now we've seen all that is related to the pain of Dioscorea. Let's understand about some other symptoms as well. So there are eructations along with hiccough in this remedy. Stomach eructations ameliorate is a rubric from Ken's repertory. Sharp cramping pain in the pit of the stomach. So cramping pain is something which is cutting pain is something which is common to this remedy. And after that there is belching, hiccough, and passing sphilatus ameliorates. It also has an action on liver, sharp pains in liver extending to the nipples, gallbladder colic. And this pain extends to chest, back, and arms as well. So abdomen pain, liver, colic, gallstones is also a rubric from Ken's repertory that we have. Piles like a bunch of cherries. So like a bunch of grapes is seen in aloes. And now we're seeing like a bunch of cherries in Dioscorea Villosa, with darting pain from anus to liver. Okay, so these are a few symptoms. Then let's understand about the modalities of this remedy. So they are worse by lying, doubling up. So they're worse from doubling up. So if they double up, so that is if they bend forwards, and if they're doubling up, that is aggravating their pains. And this is exactly opposite of the very famous remedy that we know for abdominal pains, that is colocynth. right? There's tea which aggravates them, eating aggravates them, evening aggravates, and night also aggravates. And how are they better? And these modalities have been taken from Dr. Phatak's Materia Medica, and also these few symptoms that we talked about are also taken from Dr. Phatak's Materia Medica. They are better by stretching out and by bending back. So by bending back, they'll feel better. And they're also better by motion, they're better in open air, better by heart pressure, and also standing erect. Better by heart pressure, right? And standing erect. Abdomen pain, bending backward on ameliorates. So this is the kind of picture that we see in this remedy. Okay, this is aggravating the patient, that is bending forward or doubling up is aggravating this patient, and bending back or stretching out, or just walking in open air, putting some heart pressure is ameliorating the patient. These are very important modalities that we need to remember in addition to the pains and in addition to the few symptoms that we've talked about. Okay, so this was about the modalities of Dioscorea, very important modalities of Dioscorea actually. Let's go ahead and talk more about this kind of situation. So we talked all about the abdominal pains, the liver, the GIT related symptoms until now. Now what Dr. N.M. Choudhuri tells us is that Dioscorea is equally applicable in renal colic and in other pains of spasmodic nature in urethra. So it's not that it's going to be involved only in things related to the gut, to the GIT, to the intestines, but it is equally applicable in renal colic and in other pains also. So the pain is always agonizing, writhing, and crampy in nature. It radiates from a small spot over the crest of the right ileum to the renal region and down the right leg and into the right testicle. So there is also a rubric like that: abdomen pain, inguinal region, extending testicles. So there's this whole kind of pain that we've already talked about. The same character of pain will exist, but it will radiate from a small spot over the crest of the right ileum to the renal region and down the right leg into the right testicle. So it's again shifting and radiating kind of pain. Then Dr. Clarke also adds some things that we can, we can study from. So Dr. Clarke mentions Dr. Hale considered the following indication as characteristic. So Dr. Hale considered this indication is important: a constant pain aggravated at regular intervals by paroxysms of intense suffering, just as we've seen in that case also. The same thing existed. Dr. Clarke also says that any kind of colic or neuralgia with these characteristics may indicate Dioscorea. Any kind of colic with these characteristics will indicate Dioscorea. Now, Dioscorea stands in the highest rank among stomach and abdominal remedies, with important actions in other spheres also. So, although we know this remedy for stomach and abdominal symptoms, colic, but you have to remember this for other things also. It has important actions in many other spheres as well, and we are going to see some of them just now. Okay, some of the important spheres just now. So let's see what are the other important areas. So this remedy is similarly applicable also in angina pectoris, so in heart related conditions. So you see, sharp cutting pain is there starting from the region of the heart, extends down the middle of the sternum into both the arms and hands. The same feature is observed everywhere actually, the radiating kind of pain. The chest pain cutting heart region off is a rubric present in Kent repertory as well. So angina pectoris is also one kind of pain which is very excruciating, right? And as we know, this remedy for excruciating pain, so it is also found in this situation. It is also found helpful in this situation. Then female. So the female related symptoms are that these patients have violent dysmenorrhea. Again, it's related to pain, right? So since Dr. N.M. Choudhuri is very much, in the first thing he says about this remedy is that it is a painkiller. So even in the course of the remedy, he always writes about the pains of this remedy. So again, writing about the female related symptoms, he mentions the pain, the violent dysmenorrhea of this remedy. So the pains again are radiating. So they radiate from the uterus along with cramps in fingers and toes. So again, see, we've seen that the pain of this remedy, is radiated to the distant parts, right? So that is also seen in the female related symptoms. So sciatica is something we've already talked about, right? There is this action of this remedy on the sciatic nerve as well, and hence there is sciatica. The sciatic pain, especially on the right side, shoot down the thighs with burning or numbness. Okay, along with that there is burning or numbness that we have not seen until now. So it shoots down the thighs and this burning and numbness, aggravation from motion sitting up, and amelioration by standing on toes. Can you imagine amelioration by standing on toes and by lying still? Okay, so that's about this remedy that we have not discussed. Let's just quickly revise. So, what have we learnt in the remedy Dioscorea Villosa? We've actually done this remedy majorly from Dr. N.M. Choudhury's Materia Medica, but we have also added some important points from Dr. Phatak's and Dr. Clarke's Materia Medica, and also from Dr. Choudhury's Materia Medica whenever and wherever they felt very important, right? And now, what did we learn? So, Dr. N.M. Choudhury told us, the first thing that he told us was first that it is a perennial creeper and all that. It grows in South America, southern states of actually North America, and also we've seen that it is a great painkiller, and anodyne is what he calls it, and it is even more so than opium, and morphine is what we first saw, and we all were actually, I hope we all are now convinced about it, because he's written so much about it in the due course of the remedy. Then we saw that the pain of this remedy is actually neuralgic in character, and that's why we cannot just very nicely say why it is starting here and why is it going there or nothing like that. Then we also saw about the sphere of action, which was on the solar plexus, right? On the solar plexus and on the spinal nerves, actually. On the spinal nerves. On the solar plexus, on the spinal nerves, you also saw that they acted on the ganglionic nervous system, and which was in the umbilical region. Hence, the whole of the abdomen and the nerves that are involved there are involved in Dioscorea. Nerves that are there are involved in Dioscorea. Along with that, Dr. Phatak also added that the nerve of the sciatic, like the sciatic nerve, is also involved. The spinal cord is also involved, and Dr. Boric also added that there can be any kind of abdominal or pelvic colic that you see in this remedy, since the viscera over there can be affected. Then we also saw that there Dr. Bird has told us that the pathology that you might see is necrosis of the bowels and of the stomach, right? And this actually stimulates the nerves, causing great hyperesthesia of those nerves, right? And hence the pain and the whole situation, spasm, becomes very, very unbearable for the patient. The pain is such that it is intense, it is cutting, twisting. Cutting is a very important thing because it is seen again and again, even in the rubrics it is seen. So the type of pain is cutting in these patients, and it is twisting. So twisting is actually a sensation that they have. So this sensation, you see how they feel is as if somebody has clutched the intestines and they're kind of twisting it. So the pain is very, very bad. It's very bad. Okay, as if they're being twisted mercilessly is something that they feel. So the pain is excruciating. And the pain is shifting in character, or you can also say that it is radiating. So it radiates all over the abdomen. So from here it is starting, suppose, and it will radiate all over the abdomen. And not just all over the abdomen, but it might also shift to a distant locality, which can be fingers, toes, as we've seen also in the dysmenorrhea of this remedy, right? Then we've seen that there is shuddering due to this excruciating pain. And then we talked about a case which was very beautifully explained by Dr. N.M. Choudhury. We could actually visualize because he has written it so beautifully. And then we saw a few more symptoms about it, like there were eructations, there is hiccups, flatus ameliorates the patient, even eructations ameliorate the patient, and liver is also involved. And in liver we saw that there can be gallbladder colic in these patients also, and the pain extends to chest, back, and arms, and all of that, right? And even we talked about the piles, which were like a bunch of cherries. Then we talked about the very important modalities, which were that bending or doubling up aggravated the pain. You can see it from his expression. And stretching out or bending back ameliorated the pain. So the patient is happy when he's doing that. Okay, even heart pressure ameliorated him. Going out for a walk in open air ameliorated him. Standing erect is making them feel better. Tea is aggravating, eating is aggravating, and this is aggravating, right? Yeah. Then we talked about talked about something that we just now, all that we've talked about until this part was about the abdominal pains, right? So now Dr. Phatak also tells us that it's not just about abdominal pains in this remedy, but it's about any kind of any region and this same kind of pain. If you see the same kind of pain in any region, you can think of this remedy. So if the even if the renal organs are involved, if the kidneys are involved, and then also if the same kind of pain is there, you can think of this remedy. And what happens in kidney is that the pain radiates from a small spot over the crest of the right ileum to the renal region, and then to the right leg and into the right testicle. So you see the right side is more involved. Even the sciatica was right sided, and even this pains are right sided. Okay, and then we talked about the paroxysmal kind of pain that Dr. Clarke also mentions, and finally we talked about the angina pectoris. So all the painful conditions we have kind of seen in this remedy. So angina pectoris can be there. They can have violent dysmenorrhea, and in all the situations we saw that the pain's character remained the same. We can have sciatica, and in sciatica we have seen a few modalities also. That is, aggravation was from motion and from sitting, and amelioration was by standing on toes, which is little bit different. So standing on toes, and also by lying still. And again, it was on right side, and there was also burning and numbness involved, right? So this is a quick revision of what we have already done just now, right? And these pictures should help us remember all of these symptoms forever, is what I have tried to do. So that's about it today. Thank you so much.